So without any further ado, I'll go straight in to introduce our first speaker today, Dr. Murinye Tinovonga. She's currently a fourth-year student who has a passion in infertility and reproductive health. She's going to give us a talk on knowledge, use, and attitude towards contraception in postpartum adolescence. So help me welcome Dr. Murinye to the podium.
A pleasant morning to you all. Thank you for the chance to present the paper that I co-authored with Professor Mjanja as well as Dr. Wukwime. The topic is knowledge, use, and attitudes towards contraception in postpartum adolescence. As a way of introduction, adolescence is defined as the period from 10 to 19 years. It's a period characterized by rapid physical, cognitive, as well as psychological growth. It's also an essential period for laying down foundations of good health. And so opportunities to meaningfully participate, this is also an opportunity for adolescents to meaningfully participate in interventions meant to improve and maintain their health. In terms of our key literature, when we were coming up with this topic, we reviewed a study done by Moyo and Rusinga in 2017. This was actually a study conducted in Mondoro, which was assessing contraceptive knowledge as well as use, and the attitudes towards contraception in adolescents. In terms of their population, it was between the ages of 14 to 19 years, and they actually found that adolescents between the ages of 16 to 17 years were actually the most sexually active, with up to 60% of the females who were aged 17 at that time admitting to being sexually active. We went on to also review literature from South Africa. We looked at a study by Israel, Naidu, and Titus, where they actually assessed the knowledge level of adolescents who were currently going to school at that time. And they actually found similar results in the sense that 17-year-old females were actually noted to be the most sexually active in that age group. And it was also interesting to note that in terms of contraceptive knowledge, most cited condoms being the method that they were aware of, and emergency contraception was only cited by 17-year-old young women. Hagen and Buxton did a study to assess the sources of knowledge regarding contraception by Ghanaian adolescents. And they found that TV as well as radios were cited as the source of contraceptive knowledge in 60% of these adolescents. However, only 30% noted that they had received some of their contraceptive knowledge from friends, and only 3% cited parents as their source of contraceptive knowledge. To round off our study, it was essential for us to come up with recommendations. And review of literature by Norton et al., their study done in 2017, actually noted that in terms of interventions to prevent rapid repeat adolescent pregnancies, the provision of adequate contraceptive knowledge was actually the backbone to a successful strategy. Our primary objective was to determine the knowledge level as well as attitudes of postpartum adolescents towards available contraceptive methods. We also wanted to establish their previous as well as intended use of contraception. We wanted to identify their sources of information and to assess their willingness to use long-term reversible methods. After all this was said and done, our aim was to formulate recommendations that would enable provision of adequate care to pregnant adolescents, with special emphasis on post-delivery contraception use that is available, affordable, as well as sustainable. Our study setting included the public health sector, that is Mbuyane Under Maternity Hospital, Salim Mugabe Maternity Hospital, as well as Harare City Council primary care clinics. All our participants were actually residents who resided in Harare, who were using the public health system. It was a cross-sectional descriptive study with a mixed method approach being employed, which included the qualitative as well as quantitative data. As previously outlined, our study population were adolescent females who had delivered in the public health sector from October 2023 up to May of 2024. We included participants between the ages of 10 to 19 who had recently delivered in the public health sector, who were residents of Harare City, and it was essential that they provided informed written consent prior to participation. And thus, we excluded adolescents who were unwilling to give informed consent, informed consent. And we also excluded adolescents who had severe complications during the pregnancy and hence were unable to participate in the interviews. Our study ran from October 2023 up to May of 2024. We approached 270 potential participants. However, we ended up with 255. 10 did not meet the criteria in terms of age, 2 did not consent to participate, and out of the forms reviewed, 3 actually had incomplete information. 6 key informant interviews were conducted, and these included staff from the central hospitals, as well as staff from Harare City Council Polyclinic. We did a total of 3 focus group discussions, with each focus group having 7 participants. In terms of our demographic characteristics of our included participants, 63.5% were actually in the group 18 to 19 years. The mean age of participants was 17.7%, and up to 73% actually noted their marital status as married. 82.3% had attained secondary school education. However, one of the flaws that we noted was we did not assess the completeness of that secondary school education. Most of the participants listed their employment status as unemployed, and consequently, 62.4% had an estimated monthly income of up to $100. 82% had actually been in their first pregnancy, and most of them actually listed middle adolescence, which is the period between 14 to 17 years, as their age of sexual debut, with the mean age of sexual debut actually being 16.1 years. This is a graphical representation of the pregnancy characteristics. Initially, we wanted to assess whether these pregnancies were actually planned, and you'll find that based on that pictorial representation, 75.5% actually listed their pregnancies as unplanned. 60% did admit that they did want these pregnancies, and up to 82% actually had booked pregnancies. When we asked them about when they were planning on having their next child, you'll find that the majority of participants actually had not decided when exactly they would want to have their next child, and up to 34% were actually planning on having their next child after at least 5 years. In terms of the contraceptive methods that they were aware of, you'll find that the most commonly cited method were the contraceptive pills, followed by condoms at 59.2%. And other methods such as Depo-Provera were rarely cited, with only 3.1% of participants actually listing it as a method that they knew of. In terms of their sources of contraceptive knowledge, when we looked at the possible sources that they could have, we know that in terms of our new curriculum, it does talk about discussing contraception. So that was our first stop, to ask them how many of them had actually heard about contraception from school. And you find that 57.6% actually admitted to having had a discussion about contraception whilst they were still in school. We know that in terms of antenatal care, the 7th contact is listed as contraceptive discussion being an essential part of that contact. And 61.6% actually said that they did discuss contraception during their antenatal care. In terms of post-delivery, we know that discussion about contraception is an essential part prior to discharge. 79.2%, which is actually the highest number, had discussed contraception with a healthcare worker prior to discharge after their delivery. In terms of inclusion of partners in this discussion, 61.6% actually said that their partner, they had either had this discussion with their partner present, or they had actually gone home and had a discussion with about contraception with their significant other. We also went on to see, one of the things we wanted to find out was whether social media in general, had an effect in terms of access to contraceptive knowledge. And you will find that up to 68% of our participants admitted to having access to social media, and this was only followed by television at 15.5%. And for us, this was a confirmation of the significant effect that social media actually has on this current generation of adolescents. In terms of frequency of exposure to their media, the media that they were being exposed to, 77% actually admitted to daily exposure to their source of media. When we asked them about whether they had actually come across any information about contraception on social media, 69% actually said that they had come across either adverts or any amount of information about contraception on social media, whilst 27% actually said they were not exposed to any information about contraception on social media. During our in-depth interviews, we tried to assess their depth of knowledge. We found that in terms of detailed contraceptive knowledge, it was varied. We focused on a discussion on advantages and side effects of the different contraceptive methods. And we also chose to ask a specific question because we noted that the method they commonly cited were combined oral contraceptives. So one of the questions we kept asking was, what do you do when you miss a pill? And we actually found that there was a significant deficit with regards to their approach to a missed pill, with a number of them actually admitting that they had missed a pill and that had resulted in the pregnancy. We also asked them about whether they were receiving any support from their spouses as well as their families, and we were actually pleasantly surprised. We actually are pleasantly surprised to note that about 62% actually talked about their spouse being involved in their decision. And family support was being obtained from mother-in-laws as well as sisters, which we also thought was quite significant. However, during our key informant interviews, we also identified knowledge gaps in terms of our healthcare workers. And when they were asked to cite what they thought were constraints to them imparting contraceptive knowledge, they noted that time as well as the unavailability of resources were significant constraints. One of the key issues we focused on was previous as well as intended contraceptive use. And you'll find that for most of these participants, about 138 out of 255 had never used any method of contraception prior to their first pregnancy. And when we talked about intended contraceptive use, as I had said before, combined oral contraceptives were actually the most common method that they wanted. However, you will find that 67% of participants actually wanted the implants. But when you looked at their ability to get these implants, that was one of the things the healthcare workers cited as a constraint, the fact that most of our clinics actually do not have these implants in stock. In terms of previous contraceptive use, we found that adolescents who were between the ages of 18 to 19 were actually more likely to have used contraception before. Those who were divorced or separated were actually 3 times as likely to have previously used contraception. And those who had tertiary level education were up to 20 times more likely to have used contraception prior to this pregnancy. And those who cited their occupation as students were actually 5 times more likely to have used contraception before. In terms of intent to use contraception, you'll find that the 18 to 19-year-olds were also twice as likely to have a contraceptive plan in place. And those who cited their marital status as single were actually 94% less likely to have a contraceptive plan in place. Those who were educated up to secondary school level were 4 times more likely to have a contraceptive plan in place. And in addition, other factors which favored a contraceptive plan to be in place included those who had discussed contraception with their partner, those who had discussed contraception during antenatal care, those who had discussed contraception after delivery, and those who had had access to family planning information on social media. And so we came up with a few discussion points, with topmost being that despite being aware of the different contraceptive methods, many of them actually lacked in-depth knowledge. We also noted that their attitudes were complex and multifaceted, with some recognizing the importance of contraceptives, while others were driven by fear, uncertainty, as well as misconceptions. The fear of being judged or stigmatized was a major barrier to seeking contraception, and older adolescents, those with higher education, and those who discussed contraception with their partners or significant others were more likely to express an intent to use contraception. Confidentiality and privacy concerns can be a barrier to using contraception at some facilities, and we cannot further emphasize the need for comprehensive sex education and counseling that involves not only adolescents, but their partners and family members, as being essential to promote sexual and reproductive health awareness and reducing unintended pregnancies. And in terms of conclusion, we have deduced that social media is a dominant force in shaping adolescents' views and knowledge towards sexual and reproductive health issues. And so there is need for us to provide credible online platforms that provide accurate information from trustworthy sources. And there is also need for us to publicize the existing reintegration models widely so that adolescents know that after delivery, they can still go back to school and follow their intended career paths. So our recommendations included improving sexual and reproductive health education, addressing fear and stigma, encouraging the involvement of their partners, developing credible online sources, as well as implementing targeted, auditable educational interventions, as well as healthcare provider training. And the last, and I think the most essential point, is the fact that once adolescents have delivered, there is need for them to sit down and come up with a reproductive plan. And this reproductive plan involves identifying a contraceptive method that works for them, in addition to them identifying their target and goals. For we have noted that when they have educational aspirations, when they have a reproductive plan in place, they are more likely to choose a method and actually stick with it. Thank you.